Population health measures. Population health is generally understood as a system-level concept that describes health outcomes as measured through broad spectrum of public health, clinical care, socio-economic determinants. Population health not only focuses on disease across multi-sector, but also health and well-being prevention and health promotion. Identifying valid and reliable measures of performance across these multi-sector can be challenging. Data collection, health assessment at individual, aggregate levels, payment structure, quality of patient care, public health intervention, and other components presents challenging in shape standardized implementation of population health measures. But overcoming these challenges is critical to any strategy to understand and improve it. Measuring the health of the population under this assumption reduce the calculating death rate, measuring the health of individual survivor, and aggregating across individual. As representing of director of the organization, I choose three groups of patients to be supported. First, patient leukemia patient, pediatric patient with leukemia. The second, children born with cleft lip and palate. And the third group is the HIV patient. I will speak about each group individually and why did I choose this group. Children born with cleft lip and palates. Cleft lip and palates is a congenital deformity due to failure in fusion of the palate and the lip at the intrauterine life. This deformity is highly common worldwide. It's counted as the #1 congenital deformity. This group of children suffer from physical, mental, psychological trauma which affecting overall the life of the child from birth till adulthood. The family of child is mainly affected, especially the mother, because seeing her child suffering from the defect and the inability to feed her child normally and seeing her child going through multiple major surgery to correct the deformity. We have to support that type of patient to optimize his life and reaching to his life as a maximum to normal, because this patient needs multi-medical team to improve physical appearance, social activity, and psychological acceptance. In addition, supporting the family socio-economic to provide insurance and provide reference that have the facility to treat the kind of patients to benefit the patient and his family. Pediatric leukemia patients. As we know, leukemia is a malignancy disease which affecting leukocyte. Acute leukemia is the most common form of cancer in children, compose approximately 30% of all childhood malignancy. This patient almost live half of their life in the hospitals. Child may have emotional or psychological issue that need to be addressed during and after treatment. In addition, parent and other family member can also be affected, both emotionally and in other ways, cause some common family concern during treatment including financial stress, traveling to and staying near to the cancer centers, the possible loss of a job, and the need for homeschooling. In my opinion, this group of patients need the maximum support from our center with maximum facility that we can provide to improve emotionally before physically. Those group of children need to support them by making their wishes come true, to increase their happiness and point of view of life, which will reflect on the immunity, and this will increase their benefit of the treatment. Addition to that, children usually respond to different treatment options, and mainly they respond positive compared to older ages or in the end stage patients. So it's not a loss of case if you can support a child. You either want a smile that will make up your day and remind you about your moral side, or you improve the patient health and sharing the good feeling of saving life. In conclusion, it's never late for a child. For HIV patients is the third group that I choose. HIV, as we know, is a virus that gradually attacking the immune system, which is our body natural defense against illness. If a person become infected with HIV, they will find it harder to fight off infection and disease. Supporting this target group remind you of your humanity and why God created us by humans supporting each other more in sickness than health. Those patient morbidity is very high. 25% of people with HIV are successfully keeping their under control through treatment. 75% are not. Although this does not mean to lead them suffering and sacrificing their quality of life. They know that they are a lost case. At least we encourage better environment to release their pain, improve their quality of life, and heal their soul. We should try to let them live a life that's worth living in their last period of life, and relieve their families to see them in good condition to remember, although the disease is killing them from inside more than out. What I believe that we are human, not machine. Sometimes it's not all about winning, achieving, having satisfactory result, and avoiding complications. It's about being there to those in need, to those lost a lot. Not only their health, they lost all aspects of normal standard life. In conclusion, no one wants to die alone. Some emotion, sociological support count as $1 million, especially to those in need. Again, drawing a smile at the face of patients and their families remind us of who we really are, human. Thank you.